It's not just about, okay, cut a chunk out of your belly, close it up, it'll look better, you'll feel better. There's a lot more to that.
It's not about being a plastic surgeon. It's not about making money. It's about changing people's lives. Hi, I'm Dr. Torabi.
Dr. Torabi.
The dynamic duo of elite plastic surgeons. An insight into a doctor's life.
We come from this 20,000 square foot mansion, come to the US, and we're in this 2-bedroom apartment trying to figure out what we're gonna do.
Physician burnout rate's been over 50% in the last 2-3 years.
During my clinical rotations, the first 10 months, I was like, man, I chose the wrong thing to do. I hate this.
If you're gonna have a physician shortage, the first place it shows up is like primary care.
You're living a sedentary lifestyle, you're eating like crap, and taking Ozempic. Might be losing weight, but you're losing it in the wrong place.
There's different types of meditation, right? If people pray, that's a type of medication. If you read, paint, color.
I always want to be the best. I don't want to be like the best in Arizona. I want to be the best in the world. Step by step, you try to just continue to improve yourself and see where your next win is going to be. It is important to have like 90-day goals that you can set for yourself and continue to win at that and continue to step up one moment at a time.
Welcome to the Doctor's Life Podcast. Dr. Torabi here.
Dr. Torabi.
Today we're covering a few topics, including
Breast Cancer Awareness Month, key peptides that came off the restricted list, and talking about the new breast implants that are coming out. 1st of October, Breast Cancer Awareness Month. It's a big month for us as we do a lot of breast reconstruction. We'll get underway talking about it, some of the events that we're going to attend. And then we'll talk about some exciting news that's up in the forefront.
Brewing. Starting off with Breast Cancer Awareness Month. Make sure to do the self-exams, get your mammograms if you're at the age 40 earlier. If you have a family history of it, talk to your care providers. If you need genetic testing, if you're highly susceptible, these are the things you can do to get this detected early. Again, 1 in 8 people get breast cancer at some point in their life. And the older you get, the more likely you'll get it. But even in our practice, we've seen it more and more in younger population, and it seems to be increasing. So it's important to get checked out so you get proper care, and the care you get is improved the earlier you catch it.
Yeah, and the availability of genetic testing is becoming easier and easier, and it's covered by insurance, so a lot more people can get it done. Although genetics is only like about 15% of the breast cancer. Genetics and family history of breast cancer is only very small population of the breast cancer patient. So.
And even strong family history, a lot of patients with strong family histories don't even have a genetic marker that's been found yet to correlate with it. So if you have that strong family history, you should talk to your specialist. You should see an oncologist or a breast oncologist and make sure you're covering all your bases. So you don't let something slide, especially if you're like a mom of a couple young kids. You don't want to put that burden on them if you're getting diagnosed late. It still happens, but do your part, do the best you can. And if you're not the one getting this tested, be supportive of the person next to you.
Yeah, and if you have questions about breast cancer or what you should do if you find a lump or anything, we're always at the office. We're willing to answer questions. We'll have our own Q&A sessions for our breast cancer patients. And we've done multiple videos on just education on breast cancer awareness. We're going to try to make it to some of the 5K walks to support breast cancer.
I don't usually walk 5K unless it's a day at Disneyland.
With churros.
It's something special if I'm walking that much. Getting my 10,000 step goal. Along those lines, Jenna Fisher revealed that she had breast cancer. She's the secretary at, the show The Office.
Oh, yeah.
That sits at the desk. So she just went through it, and she just had a lumpectomy, radiation, and required chemotherapy. It was small mass, which is great, but it was like triple marker positive. The 3 markers you're usually going to hear is HER2 new, estrogen, progesterone. HER2 new is more aggressive. Estrogen and progesterone positive are better defined cells, so they're actually less aggressive. They're more easily treatable, and there's other medications and stuff that you can take to suppress those, like hormonal lines. So she was triple positive. So even though she got the lumpectomy, she needed radiation and chemotherapy, likely an estradiol, something like that. But anytime with lumpectomy, you do get radiation. With mastectomy, that decreases the
rate of recurrence.
So things to know: radiation generally reduces the rate of local recurrence, and with the use of radiation with lumpectomies, it's that breast conservative therapy line. It's a great option for some people. But otherwise, if you have a mastectomy, you still might need radiation. It just varies on how aggressive the tumor is.
Yeah, how the size of the tumor, where it's spread to, and possibly if it's spread to lymph nodes, you need radiation and chemo, or chemo alone. These are things that are discussed with the radiation oncologist and the oncologist.
Yeah, to keep it simple, radiation usually for local recurrence. Chemotherapy is more systemic to protect the lymph nodes, stuff like that. Most likely place breast cancer is going to spread is to regional lymph nodes before it spreads to the rest of the system.
All right, done with breast cancer. So one of the things that's like pretty exciting is our peptides being brought back to the market and taken off the FDA ban, the category 2 ban. So the peptides that came off were BPC, which there's pentadecapeptide, which is very similar. I think it's got 1 amino acid difference. The CJC apomorphin's big. Thymosin beta 4. These are all great, especially if you're looking to build muscle and recovery from workouts. I use them quite often, and I put
so
in my
they're
order
some of the
right
most
away.
commonly used peptides, right?
Yeah.
For longevity, building muscle mass,
Yeah.
even some type of healthy weight loss.
Yeah.
So CJC ipamorelin, what's that good for?
So growth hormone peptide releasing hormone and growth hormone releasing peptide, they're good to increase the production and release of growth hormone in your system. Good for sleep, better skin, increased lean muscle mass, better thought process.
Overall health, right?
Yeah,
Bone density,
overall, yeah.
because this just affects the amount of growth hormone your body naturally releases.
I just started I switched over to tesamorelin for a little bit. The recommended doses of tesamorelin is like 1 milligram every day for 6 days. I take half that dose to try it out, and I'm probably going to cut that in half. And surprisingly, I don't know if it's the Carol bike or what. I put on 5 pounds of muscle by the in-body scale, and I've gone down like 0.4 in body fat percentage. So is it the tesamorelin or what's going on?
That's pretty good.
I know.
If you're cutting down body fat percentage, and that's just straight up
I
adding lean muscle.
In-body, I was like, shit, I weigh 204 pounds, and I was like, my body fat percentage is the lowest it's been, and skeletal muscle mass increased by 5 pounds.
So I think people our age think when it's hearing stuff about growth hormone, you don't realize the difference between growth hormone releasing peptides and just injecting growth hormone. One's to try to actually live a healthier life, build on longevity, feel better, better sleep, like you said. And another one's trying to hit 71 home runs in one season.
I've taken both.
There we go.
I'll say that. So one of them is going to shut down your system of producing growth hormone. And for someone like me, it wasn't just that. It's getting carpal tunnel and joint pains. Like you get up and...
It was a little scary just seeing you having those symptoms. You weren't afraid of it.
Yeah.
But I'm just you can definitely not just take growth hormone and...
And I was even taking the lower doses. It's just you get so much swelling and bone growth that in closed spaces.
Not just bone, ligaments, tendons, everything tends to overgrow. Forehead.
Yeah, in an enclosed space.
The forehead enlargement won't cause any
I just shaved
symptoms.
that down.
Yeah, and it doesn't cause any symptoms. It just will affect your selfie.
Yeah.
So you got to keep note of that.
But as we thought, was it a big pharma thing that the FDA regulated these? And guess what? That same day the FDA released these peptides, they took tirzepatide off the short list.
Yeah.
Not the short bus, but the short list.
Yeah.
Or shortage list, which means that the compound pharmacies can't make any tirzepatide. So what does that do for the community? People that have been on tirzepatide, now you're going to have to pay if you're getting it through insurance. Not many of them cover it, and you're paying $1,600 a month for Tirzepatide.
So Tirzepatide's the generic name for Mounjaro. It's one of the leading GLP-1 agonists. Also affects GIP receptor 2. Phenomenal drug, but it's kind of like regulatory capture. You have the big pharma lobbying Washington for all this stuff.
Yeah.
So this is what you're going to see.
But the compound pharmacies are going to mix them with some vitamins or some other peptides to be able to get them out. We'll see what happens.
I think it's just temporary, especially with like...
I heard it's not, when they put it on the shortage list, it was just Novo Nordisk that makes semaglutide and what is it? Eli Lilly makes Mounjaro. They couldn't make the needles as fast as, because they can make the medication.
It's not even the medication, it's the injection.
Injection. That was the major issue.
Everybody like going through insurance, it ends up like costing $1,200 to $1,600 a month, right?
Yeah.
And it's like you can regularly get this for people at way lower price, like $200 to $300 a month.
Pharmaceutical grade's going to be stronger, but really how much stronger?
So. I mean, it's all pharmaceutical grade, right?
Yeah.
So,
well, yeah, but
what do you mean?
But like just their mechanism of action is going to be somewhat different because
I just think they make it easier because like I've heard people with like semaglutide, it's like, oh yeah, I felt okay with this. So I just clicked the pen a little higher the next day, but I needed more pens that month. Yeah, that's how they get you.
With the Mounjaro, they're not clickable pens. You don't control the dose. So you get, they give you single dose.
All right.
Yeah.
CJC, ipamorelin, huge benefits with growth hormone release peptides. So it uses your body's natural growth hormones, releases them optimally at the right time of day, as long as you do twice a day or once a day.
You control it. You control when you want to inject it.
But ideally, it's once at morning, once at night, 5 to 6 days a week.
It depends what you want to do. So you're going to get your release once you fall asleep and you hit that deep sleep phase, you're going to get the growth hormone release. So if you want 2 releases, you do like an injection early in the morning. So you get that, you get 2 bumps. I used to do it at night. It becomes cumbersome to be doing injections, twice a day.
Yeah.
So I just do it in the morning.
Okay.
Because at night, sometimes it would get iffy, because you want to be fasting 90 minutes before you inject it. Otherwise, if you take any carbs, or I think carbs or proteins, that could decrease the effect or like not having any effect if you eat something. So you wouldn't get that spike in your growth hormone. So it's like you're just injecting for fun.
Got you.
Yeah. So you want to be fasting 90 minutes before and 30 minutes after the injection. So.
And the other key peptides,
BPC is the biggest one, which, like...
I can't believe they even had that on the list.
I don't know why it's like banned by WADA, the World Athletics Association.
Pretty much anti-inflammatory, right?
Yeah.
And improves gut health.
Like the gut health part, the oral was still available, which you could still do that. But the injectable, like for aches and pains and like tendon and ligament repairs, I've had patients with like ACL tears and like they've injected it and, their orthopedic surgeon can't believe how fast they healed post-surgery. It almost looks like they had nothing done. Yeah. You could either inject it into the knee or just in the stomach. It doesn't matter. You don't need to inject it into the joint.
Yeah, that's what I'm saying. Not even into the joint, even like
just
sub-Q,
around it.
close to the area.
Yeah.
Kind of like regional.
Some of the people that work for it, a lot of people have back issues and back pain and nothing else has worked, but they've done this for 2-3 weeks and that back pain's gone. And that's huge benefit. And especially, like when I did that in TB4, like I could probably like work out as hard as possible and like do the same thing the next day. It's like, if you're talking about a pre-post workout, that recovery is going to be quick and you could burn through whatever you want. It's definitely good peptides for that.
And what else was on that list?
I
think those are the 2 main ones. I think the rest are, was it TS4?
Well, it was TB4.
TB4, I'm sorry.
The BPC, CJC.
Yeah, those are the main ones. They were 5, but those are the main ones. And the other 2, I think, worked along the growth hormone. Pathway. So key takeaways, you don't want to do straight up growth hormone. It shuts your body's natural ability to create growth hormone with these releasing peptides. It just promotes your body to make the proper amount. You do have to cycle or else you're going to burn out. Anytime you're talking about hormones, you kick stuff into extra gear for a long period of time, you're going to burn out receptors and you're going to burn out your body's ability to create those hormones. So you definitely want to follow the cycle. You're not on there for 12 months straight, likely 3 months on, 3 months off, or even 3 months out of the year. And then when you're taking it, it's like 5 to 6 days a week. Those are the takeaways for growth hormone releasing peptides. With BPC, you probably don't need to take that all the time continuously.
With any of these, I'd cycle them,
Yeah.
because your body doesn't always need them. BPC, especially, or TB4, and especially you're injecting them. I would recommend like taking BPC injections maybe 2-3 cycles a month at a time throughout the year. You could do oral for a month in between as well, or a couple months, just for your gut health.
Yeah, I think it would serve a different type of benefit doing it oral.
Yeah, I'm looking up. So Cellank was another one that got released. I took it and I thought it made me too chill. My wife's like, "You're on peptides and you're working slower than you usually do." I'm like,
"How are you more chill?"
All right, I do not need to be on this stuff. That's why the spray's still sitting in my fridge. AOD was the other one, but I'm not sure.
AOD works on mitochondria?
No, AOD's the anti-obesity drug. That's what AOD stands for. I don't think they released.
Oh, like exercise?
Yeah, so it was.
I'm going to release my AOD diet. Oh, wait, the D is drug. Sorry. So it's the AOE. No, AOD.
Anti-obesity drug.
Anti-obesity diet. I'm going to release my AOD. I'm going to make an Audibles book.
TA1 and AOD 9064. So AOD 9064 is basically a chain of the growth hormone peptide. And it helps with
releasing
weight loss.
Peptide, you mean?
Yeah, I think
growth hormone peptide versus...
No, it's not. It's just growth hormone. It's just
growth hormone.
Yeah, it's just portion of the growth hormone.
Gotcha.
Because growth hormone's 191 amino acids. So it's a protein. So AOD's a small portion of that.
Okay.
It's the weight loss portion of it. So
it attaches to the cell
weight
receptors.
Weight loss, and it's used big in the bodybuilding world because of the lean muscle mass with it. And it's stronger than the CJC ipamorelin, but probably pretty comparable with tesamorelin.
Okay.
And then the TA1.
I didn't realize tesamorelin was stronger than CJC.
Yeah. Oh, yeah.
You've told me a couple times, but it's just like, it's hard to like, I'm
yeah.
just like, CJC is gold standard. But
Yeah. So it wasn't TB4. Thymosin alpha 1 got taken off. And I love that because I carry my secret juice with me all the time. Like if you go on flights or if you feel a sore throat or your kid's got a cold, I do like my injections. I'm like, all right, I'm doing this for the next 1 to 3 days. And like your symptoms are gone. Your sore throat, whatever, you're not going to get a cold. I'm not going to say like it's going to cure COVID, but it could.
I just drink orange juice and do.
Instead of getting vaccinated, I'd rather take TA1.
Talking about vaccinations again. The flu vaccine this year, 30%
effectiveness. Oh, I'm so glad I got it.
That's actually really good because they say.
But we haven't even hit flu season.
There's a lot of people getting the flu around me. Yeah. This guy. Oh yeah. This is why we didn't have an episode last week. Our producer came down.
Is the flu going to be called Milton or what?
No, it's like COVID the 28th. Oh, I got one for you. Why did COVID not get served at the bar?
I don't know.
Because COVID-19.
I heard a stupid one this week too, but
let's hear it. I love stupid jokes.
I was like, that's erased out of my mind.
Rom's not here. He's great with those horrible jokes.
Yeah.
And somehow he remembers them too. I think he writes them down.
Yeah.
Dude had no patience today in clinic and came in with a 3-piece suit.
I know he had a 3-piece suit. I'm like, what are you dressed up for?
What are you doing?
Yeah.
We're gonna have to.
We got to put him on Tirzepatide.
I think once we put his face on here, he'll feel more legitimate.
Yeah.
And he'll listen to us. I think definitely putting his face like really small, like on one of those bookshelves back there would be perfect.
So let's go into what have you been doing this week?
This week,
And what do you have coming up?
came back for free flap breast recon, breast cancer patient. It was a tough one to start the week.
Yeah, the massive weight loss patients for some,
Their
the
anatomy-
abdomen's easy, but the
abdomen
anatomy
is
for the
very
thighs is-
reliable. Yeah. So our first go-to site is the belly, the DIAP flap. It's the same tissue that we discard during a tummy tuck, except we elevate it on the tiny blood vessels that feed it, disconnect it at its source, and hook it up to your chest vessels. My secondary site is the pap flap, which is the inside of the thighs. That's where it gets a little more tricky. The reason we like the belly more than the thighs, the belly generally has better tissue and it's more
tissue,
sizable, more
vessels.
similar to breast tissue than anywhere else you find in the body. And the vessels that feed it have the proper length and the diameter to match the vessels in your chest. When you get to the inside of the thighs, you still have a good combination. It's usually less tissue than the belly. But for this patient, she had tummy tuck or paniculectomy or tummy tuck already.
Yeah, she had a tummy tuck.
She had a tummy
after
tuck.
massive weight loss.
She looked great, very motivated patient. So we used the tissue in her legs. But her anatomy with the massive weight loss, you just got to be careful. You can't just go willy-nilly like dissecting through like.
Yeah, their skin just hangs, so it's like, where is the vessel actually attached? And
it's you just got to rely on which way the muscles run. Okay, this is the gracilis. I got to go below this.
Yeah.
This is the adductor longus. I got to go below that, and it's just like just being confident in that.
Yeah.
Because you'll see some huge vessels.
Yeah.
Especially with patients' massive weight loss.
We used to do the tug or gracilis flap, and a lot of times you're like dissecting it and you're like, this goes through the muscle. The adductor and the gracilis, they almost run the same pattern. So you have to just like be sure which one it is and like make sure you're at the adductor. And that process of getting between the gracilis and the adductor is like almost the biggest step, because if you're going past the gracilis and you think it's the adductor, and like you chop through that and like the vessel, then you're
it's also like you see a big juicy vessel, you don't want to just go through it until you find your main perforator, because you're just like, I'm pretty sure this isn't the right one. But if that is your right one and you just blow through it searching for another one, you might have like just burned through your main blood supply. Monday I took my time. It was a little more painful. The nice part about these is like the first side might take you some time, especially if you haven't done it for some time.
Yeah.
Being like a secondary option rather than the DIAP flap using your belly. But that second side is like, boom, gone. Yeah. I know this. I just saw it. And I think anecdotally with the pap flaps from side to side, people are more similar with their pap perforator anatomy than their deep perforator anatomy. So their thigh anatomy for their perforators that supply the skin and subcutaneous tissue is more similar on both sides than the belly. The belly, you sometimes get one that's lateral.
That's why a lot of times people don't even get the CTAs for the pap flaps, right? Because I don't think it's necessary. I think that it makes it a little easier, but
it kind of gives you a little bit of comfort. Honestly, the most comfort I get is the shorter amount of time between pap flaps I do.
Yeah.
Like if I did one 2 weeks ago or a week ago, I'm gonna just fly through it.
Yeah. But because it could be a shorter dissection. It could be like an hour-long dissection versus, like for the deep flap, it could take like 2-3 hours if it's intramuscular.
Yeah, still.
Or PAPs too.
I mean, it's just for the deeps, I've noticed, even if it's intramuscular, we move pretty quickly on them. It's more on like just like on the scan, seeing like a strong perforator or strong two perforators. When you start getting like more than two perforators and dissecting that stuff with the tiny like side branches and stuff, like adds a ton of time. It's been fun. I've been enjoying it. And the nice part is I was on vacation last week. So it's the first time I've come back like refreshed in probably a year. All my other vacations, I've hung out too much or whatever, rather than like relaxing. I come back almost like more tired than like just working through it. This, I think I texted you the weekend, like on my flight back, I was like, dude, I feel like really refreshed. I'm like gun ho, like let's get after it. Like, I don't know why I even said that because we do it anyways, but feeling like really good, especially going into like our busiest portion of the season. So it feels good. Like I feel good. Another thing that adds on to that is the positive, like patient responses. That stuff goes a long way. Patient interactions, like just seeing how good people are doing, how happy they are, and the role we serve in that like process, whether it's like reconstruction or cosmetic.
It's a busy week, and like I don't know when it's not going to be a busy week. This week I've had a lot of male breast surgery. You know, I had a gynecomastia, and then I came and helped you with the flap on Monday. You know, liposuction and gynecomastias, like pretty much our most popular male surgery. We do 2 or 3 a week.
It's approaching most popular surgery overall.
Yeah. So, and then today I had another one that I did, gynecomastia and liposuction of the back and abdomen. And then I had clinic with tons of new patients. And then tomorrow I have another one that's an abdominoplasty and a gynecomastia, another guy, and same thing on Thursday, doing another gynecomastia and liposuction at the abdomen in office. And Friday's going to be all female, doing breast. So the male cosmetic surgery, I think it's becoming more popular. And I think maybe with the weight loss treatments, they're getting more common. What has your experience been?
It varies. It's like, you know, that like grade 1, 2, 3.
Yeah.
And like the grading systems, you're like, while you're going through training, you're like, oh, okay, I got to know this for the test. It kind of like breaks down a good amount. Like there's some gray area between each grade, some great options for people, and the recovery is so fast.
Yeah.
It's like just seeing the patients go through. It's like, you know, just kick back a little bit. We don't want to just develop a hematoma or something. Just chill a little bit for like 1 more week. But patients are like, go. Like this is.
Well, and Arizona's a little different than anywhere else you practice. It's like people are pretty active and like, you know, outdoorsy or even hitting the gym. Yeah. Like they almost want to go right away. Yeah. Or pickleball nowadays. I was actually going to talk to you about like I saw something on Instagram open up like a franchise pickleball like recovery center type of thing. I think it's gonna be a big gym like fitness center.
Just have your physical therapist, your elbow shoulder guy there too, and like 100 pickleball courts, and just
you only need like 3 or 4. No.
I'm pretty sure. I'm pretty sure if you have 100 courts in Arizona, especially, they're gonna fill up. Especially if it's indoors.
You got to make it more exclusive. The less you have and charge more.
Just have more and charge more. The way it's grown right now. You have
1 hour time limits. You have 1 hour time limits and like.
Forget your time limit. This is your day. This is your special pickleball
all right,
day.
You go and buy 300 acres of land and we'll see. Yeah. But the way to set it up is 4 courts.
I'm talking crap.
Hot tub and red light therapy.
That doesn't sound bad at all.
Recovery center,
anybody wants to start this up and need us as consultants.
I saw it on Instagram. Someone's already doing it, trying to franchise it. But I think we could set one up.
Already not been taken.
But you got to just give them the service, and you have physicians doing it. So I think it will work even better.
Then you can take it another level, selling the rackets.
Another exciting part of the week, we're going to be on Andy Elliott's podcast in a couple of days. So
that's right. That's coming up. Podcast to podcast.
Any other new exciting
stuff? Medical news? Not really. I was off, so I wasn't like scouring through like Nature, Science, JAMA, New England Journal of Medicine. Like I usually do, at least like go through titles and see like what catches.
I haven't even gotten new, like, you know, I usually get like daily emails, top 5 articles.
What do you sign up to get that?
Like some Medscape and stuff have.
Okay. A lot of them I notice with the top journals with their newsletters, they do end up highlighting the same papers, even if they're like published by different people.
Yeah.
So that virality aspect of like what people consider like social media is same thing with medical literature.
Well, when you look up plastic surgery news, it's just about Cardi B revealing about plastic surgery posts.
She had plastic surgery?
No, she didn't. People are talking crap after
She
her
definitely
giving
had plastic
birth.
surgery.
But
Oh, after birth?
after giving birth, because
Oh, no, I was
she's
just going to say
skinny down.
No, you'd be surprised with how much people can get into pre-pregnancy shape with
Ozempic?
Not just Ozempic. I honestly think like just maintaining and doing proper like exercise routine leading up to the pregnancy. Obviously, probably stopping like a month before the due date or something.
Yeah.
And then like picking it up shortly after birth. That's what I think like really sets the body's metabolism.
I know your wife like worked out pretty late into pregnancy, right? Like my wife, I don't know how she didn't explode after 20 weeks. So it was always
Sarah was
hard
doing
for her
Zumba
to get
until I think like 3-4 weeks before her due date.
Pam couldn't even seemed like she was waddling around like after 30
I was just concerned with the amount of, with all the Zumba she was doing, with the amount of pit bull she was listening to. It's like, I don't want my baby in the womb listening to that much pit bull. It's got to be a right amount, but an hour a day for like 5 days a week, Mr. 305. I don't know. That might be too much. Yeah, she was doing Zumba. Like, she was just like, my pelvis hurts when I'm doing Zumba. You don't know how hard this is.
Stop doing Zumba?
I wish I could feel your pain. I can't. You're making me feel like I'm having male regret syndrome.
So are they going to be able to do plastic surgery to make you feel the female pregnancy?
I think, do you know that Willy Wonka, Charlie and the Chocolate Factory?
Yeah.
One of the kids gets turned into a blueberry. If we could recreate that, I think that pretty much like kid just freaking blows up and then gets rolled out of the room. I'm pretty sure that's what pregnancy is like. God gave women the gift of pregnancy so they can just complain to us whenever they want, tell us how bad they have it compared to what you're doing. Because no matter what you're doing, what they're doing is worse. So we're here to support you.
New implants coming to the market. It's been in Europe. I've removed a couple from people that had it done in Mexico. Not because there was a problem with the implants. It was just patients wanted larger implants. But the Motiva implants, I
haven't heard of them.
They're actually like, I don't know. I kind of like them because I think I don't know where they're out of, but like they've got this light texturing. They're soft, but like they keep their shape and they're like almost completely full. So you see like almost no rippling. We're going to see decreased capsular contracture rate with them, and especially with mastectomies, keeping that shape. I think they're going to be a good addition, pretty much like calling them the 6th generation of breast implants. So
hopefully they'll stop generations.
Yeah, they already had the Motiva tissue expanders were FDA approved for use.
Okay.
But the Motiva implants, and they're silicone implants, they hadn't been approved for use in the U.S.
Is it a cohesive gel? Like
it's really cohesive. Okay. Yeah. It's like, I think, going to be your gummy bears on steroids.
Yep. Gummy bears.
They probably had to do extensive studies because of the texturing and stuff and being able to bring it to the U.S. and because
again, there's
the textured implants had that downfall with.
Is this the micro texture?
Yeah.
Well, like Mentor is selling micro texture still, right?
Allergan doesn't have it anymore because theirs got taken off. Not theirs got taken off. They pulled them because it seemed like their form of texturing was the main ones they found, ALCL or rare form of lymphoma. Sientra has texturing. Mentor has texturing. Mm-hmm. They have the textured implants. A lot of people moved away from them. And most of all the shaped implants were textured. Not many people are putting those in. And that was the big talk right before this whole ALCL thing was, have you done a shaped implant, or do you know how to put them in? I wasn't quite happy with them anyways because they flipped quite a bit no matter how tight you made the pocket and what mesh you had.
Shaped implants.
Yeah.
It looks nice when you're standing up, but it's weird when you have that same appearance when you're lying down.
Yeah.
Where like your round implant, people are like, oh, maybe that doesn't look natural.
Yeah.
But when you stand up, even imaging studies have shown they take that teardrop shape.
Yeah.
And then when you lay flat, they take your natural breast shape when you
Well,
lay
with
flat.
the Motiva, they don't change shape much.
Yeah.
They're pretty nice implants. Can't wait to start using them.
I think having just more competition is good. Having just 3 companies that have just run the market for this many years is not a good thing. I mean, 3's better than 1, but
it's especially for the patients getting them, because they're going to get better and better and last longer and be more durable and have more studies. Have more studies, drive down costs.
And if another one causes some type of weird stuff, you have more options to go to.
Yeah, that's why like the whole craziness with silicone implants, where everyone had to change, like they could only put in saline implants.
It's the Life, the Doctor's Life podcast.